Good day, and welcome again to Learning Pharmacology with me, Nurse Myron. Today we will be discussing cholinergic drugs. And for our full disclosure, I am not affiliated with any of the manufacturers of the drugs or other items mentioned in this lecture. The mention of such brand names are only in passing and for educational purposes only, and are not for commercial promotion. I have no actual or potential conflict of interest in relation to this presentation. So let us begin with a review of the parasympathetic response and the parasympathetic nervous system. Recall that the autonomic nervous system has two main branches, with generally opposite effects. The sympathetic response responsible for fight or flight, while the parasympathetic nervous system responsible for rest and digest. Our focus will be on the parasympathetic nervous system, again dominant during rest and digest. The primary neurotransmitter involved in the parasympathetic nervous system is acetylcholine. It is both found in the pre- and postganglionic fibers. In general, the parasympathetic nervous system is slower, more localized, and focused on fine-tuned control. So here we can see the major organs affected during the parasympathetic response in graphical form, and here on tabular form. So as we have mentioned, the primary neurotransmitter involved is acetylcholine. It is released by all preganglionic neurons in both the sympathetic and the parasympathetic nervous system, but for the parasympathetic nervous system, it is the only neurotransmitter involved. It acts on nicotinic receptors in the ganglia, but on muscarinic receptors on target organs. Muscarinic receptors mediate parasympathetic functions throughout the body. They are generally found in the heart, smooth muscles, and major glands. Muscarinic receptors are activated by acetylcholine. They play a critical role in heart rate regulation, digestion, bronchoconstriction, with 5 subtypes, muscarinic receptors 1 to 5, mediating diverse inhibitory and excitatory effects. When activated, they affect on cognitive function and memory. M2 subtype of muscarinic receptors are primarily located in the heart, especially in the sinoatrial node and in the ventricles. When activated, they decrease heart rate and conduction velocity, thereby decreasing the blood pressure of the patient as a consequence. M3 subtype of receptors are found all over the body, especially in the smooth muscles, in particular the bladder, the intestines, and the bronchioles. Likewise, they are found in exocrine glands, especially the salivary glands and the tear glands in the eyes. When activated, they promote contraction and secretion of these fluids. M4 and M5 subtypes of receptors are located primarily in the central nervous system. When activated, M4 primarily acts on locomotor regulation, while M5 acts on the dopaminergic transmission. So now we move to the drugs known as your cholinergic agonists. Again, remember the clue that I shared with you before. Agonists means yes, yes, go. So these drugs essentially go by acting at the same sites as the neurotransmitter acetylcholine. They also enhance the activity of acetylcholine receptor sites throughout the body. In effect, they mimic the parasympathetic nervous system and the parasympathetic response. Because of this, cholinergic agonists are sometimes known as your parasympathomimetics. Acetylcholinesterase is the enzyme that terminates nerve impulses by destroying through hydrolyzing your acetylcholine. It breaks down acetylcholine into acetic acid and choline. Therefore, if the levels of acetylcholinesterase are high, the levels of acetylcholine remain low. So first we go to your direct-acting cholinergic drugs. Again, these drugs mimic acetylcholine by occupying muscarinic cholinergic receptor sites on effector cells, thereby producing the parasympathetic response. For example, decreased heart rate and myocardial contractility, resulting in subsequent decrease in blood pressure. It also promotes vasodilation, bronchoconstriction, and increased bronchial secretions or bronchorrhea. It also promotes increased GI motility and secretions. Likewise, your increased bladder tone and relaxation of the sphincters, resulting in increased defecation and urination. Lastly, it also induces meiosis or pupillary constriction. It promotes the contraction of the detrusor muscles of the bladder, making the patient urinate. Typically, bethanicol should be taken on an empty stomach. However, some side effects include some abdominal cramps, nausea, sweating, and flushing. Next, we have your pilocarpine. Brand name is isoptocarpine. These are available in eye drop forms to treat glaucoma and ocular hypertension. In addition, sometimes pilocarpine is administered prior to eye surgery to constrict the pupils. The mechanism of action is it constricts the pupils to increase fluid drainage from the eye. Common side effects of pilocarpine include stinging sensation, headaches, blurred vision, and poor night vision. Therefore, after administration, patients are asked to rest and to avoid any strenuous activity, including driving. The next cholinergic that we will be discussing is your carbachol, under the brand name Myostat and Caracol. These are potent parasympathomimetic agents that mimic acetylcholine. Together with pilocarpine, these drugs are also used in ophthalmology to treat glaucoma and to induce meiosis during surgery. Likewise, carbachol decreases intraocular pressure. Common side effects include eye inflammation, blurred vision, headaches, and other systemic effects like bradycardia and abdominal cramps. Next, we have your cevimeline under the brand name Evoxac. This is a selective muscarinic agonist used to treat xerostomia or dry mouth. Xerostomia is a secondary symptom usually found in other diseases like Sjorgen's syndrome, diabetes, or as an effect of radiation therapy. Cevimeline acts by stimulating M1 and M3 muscarinic receptors to increase saliva production. However, since it is a cholinergic drug, side effects include excessive sweating, nausea, diarrhea, and even headache. Typically, cevimeline is taken as a capsule 3 times a day. So now, what are the nursing considerations when administering direct-acting cholinergics? As nurses, we should perform careful assessment and history taking to identify any allergies to cholinergic drugs. Caution should be observed when giving these to patients with bradycardia, hypotension, or with coronary artery disease. Likewise, direct-acting cholinergics are usually not given to patients with peptic ulcers, intestinal obstruction, and recent GI surgery because the increased GI motility can be harmful to the patient. Furthermore, Direct-acting cholinergics are not given to patients with bladder obstruction because it can worsen and eventually fill the bladder. Direct-acting cholinergics are also contraindicated for patients with epilepsy and Parkinsonism because of the possible central nervous system stimulation effects. Caution should also be observed in patients with hepatic and renal dysfunction because the drug metabolism is affected. Lastly, caution is observed when administering to pregnant and lactating women because of the possible effects both on the fetus and the newborn. Now we move to your indirect acting cholinergic drugs. As was mentioned earlier, these drugs do not interact directly with your acetylcholine receptors. Instead, they inhibit acetylcholinesterase, or the enzyme that is responsible for degrading acetylcholine in the synaptic cleft. By lowering the level of acetylcholinesterase, we can now increase the availability of acetylcholine, and its action is prolonged at the cholinergic receptors. So these are just some of the drugs that fall under this category. We have your anti-myasthenia gravis drugs, neostigmine and pyridostigmine. They come under the brand names prostigmine and mestinol respectively. Another drug, your edrophonium, is not counted as a treatment and instead used to diagnose myasthenia gravis. We have a separate discussion on myasthenia gravis under the topic neuromuscular and neurologic conditions. Likewise, under the same discussion, we have your anti-Alzheimer's disease drugs. So these are just a few of the examples that we will be discussing later. You have your donepezil, rivastigmine, and galantamine. These drugs are used in mild to moderate Alzheimer's to enhance cortical acetylcholine. Now we discuss the last classification of drugs, your anticholinergics. Anticholinergics, from the name itself, block or inhibit the action of acetylcholine at the muscarinic cholinergic receptors, both in the central nervous system and the peripheral nervous system. These drugs are also known as parasympathetics, from the word lyse, meaning to degrade or to reduce the parasympathetic effects. Anticholinergics are used to treat COPD, overactive bladder, dizziness, movement disorders, stomach, and GU cramps. Remember in our ganglia that acetylcholine is the neurotransmitter involved, and it activates both the nicotinic and muscarinic receptors. Therefore, drugs acting against this can be classified as anti-muscarinic blockers and anti-nicotinic blockers. Next, we have your anti-nicotinic anticholinergics. These drugs block nicotinic receptors and are generally used to interrupt neuromuscular transmission. For example, we have succinylcholine. It is a rapid-onset, short-acting depolarizing neuromuscular blocker used to induce muscle paralysis for short-term procedures. For example, endotracheal intubation. However, this is not the drug of choice for anesthesia. Instead, we have your vecuronium under the brand name Norcuron and rocuronium under the brand name Esmeron. Both are intermediate-acting and non-depolarizing neuromuscular blocking agents used in anesthesia. Rocuronium is generally preferred for its rapid sequence induction due to its faster onset of action, usually about 60 to 90 seconds, compared to the slower vecuronium, usually about 2 to 3 minutes. Both offer similar intermediate durations. Finally, we have our anti-muscarinic anticholinergics. These drugs block the acetylcholine at the muscarinic receptors thereby inhibiting parasympathetic nerve impulses. Examples include your atropine, scopolamine or hyoscine, oxybutynin, and solifenacine. Atropine is derived from the plant Atropa belladonna, hence the name atropine. It is indicated for symptomatic bradycardia, especially for cardiac events and given intravenously. It can also be used to reduce salivation and secretions during surgery. Likewise, it is given to decrease GI motility during certain cancer treatments, like for example, irinotecan. However, in such cases, the preferred route is intramuscular. Atropine is also used to reverse cholinergic poisoning, such as insecticides or mushroom poisoning. Side effects of atropine include dry mouth, blurred vision, tachycardia, and constipation. Remember that the antidote for atropine is physostigmine. Next, we have your scopolamine, which is locally known here in the Philippines as hyoscine or hyoscine N-butyl bromide, sometimes abbreviated as HNBB. Hyoscine blocks acetylcholine receptors in the nervous system, thereby preventing nausea and vomiting from motion sickness or even post-operative nausea. It also controls abdominal and genitourinary cramps and spasms. Common side effects of hyoscine include dry mouth, drowsiness, dizziness, and blurred vision. Locally, hyoscine is available in tablet and parenteral forms. Last, we have your oxybutynin under the brand name Driptane and solifenacine under the brand name Vesicare. These drugs are indicated for overactive bladder symptoms, such as incontinence, frequency, and urgency. It works by relaxing the bladder muscle. Side effects of oxybutynin and solifenacine include dry mouth, constipation, dizziness, and blurred vision. Solifenacine is generally more preferred because it is given only once a day and has lesser side effects. However, oxybutynin, the earlier form of this drug, is cheaper and has more available forms like tablets, patches, ointments, and gels. To bring this discussion to a close, we have other anticholinergics like ipratropium and tiotropium for COPD and benztropine for Parkinson's disease. These drugs will be discussed separately under their specific categories. I hope that you learned a lot in our discussion today. Thank you for listening and continue enjoying learning.